Hi everybody, thanks for coming on tonight. I'm Dr. Rachel Northern. I'm a family wellness chiropractor. We're talking about pelvic health and core strengthening. And I am here with Kristi So she is a physical therapist and she's certified in all these pelvic floor techniques and things like that. So that's why I asked her to come and share some knowledge on this. I'm going to talk about the chiropractic side of this pelvic floor, what's all involved with the nervous system and things like that, and then I'm going to hand it over to her. Sorry we're having some difficulties, so we do have a PowerPoint, so hopefully we can zoom in for our recording. And at the end, please share questions and concerns, and please pick Kristi's phenomenal brain on this thing, so if you have questions for yourselves, okay? So I'm going to start off with, I am certified in pregnancy, Webster technique, and so we work with a lot with the spine in chiropractic. So for chiropractic, our premise is, looking at the spine and the nervous system and the bones and how they correlate and if there's tension on the spine. So my point of when I deal with women that have issues, I do have a lot of tailbone pain that comes to my office. I do have sometimes groin pain, pubic bone pain, things like that. But people don't think about how these nerves not only control pain, but I've also had females, by just getting adjusted because we're stimulating the nervous system, I've had women that their cycles have improved. I've had teenage girls where they had less PMS, things like that, because all these nerves, we forget that I brought my posters today. All these nerves, you're not going to see this writing, but it controls the reproductive system. It controls our ovaries. It controls our uterus. It controls, your bowel movements, all that kind of stuff. And also it controls those muscles that go to the pelvis. So she's going to talk more about the pelvis and the floor and all those things, the muscles involved in that. I'm kind of talking about the hard structure. So I want to make sure all these are balanced structurally underneath to take, pressure off the nervous system. And my other scan here, let that one go. I always talk about when people come into my office, function versus feeling. So a lot of women maybe say, I just feel weak. I don't feel, maybe not pain. Pain's only 10 to 15% of the nervous system. So there's a small percentage there that, we're relying on to say that we're dysfunctional, when we also got to look at the motor system, the muscles, all those kind of things, and also the stuff I talked about, the function of the organs that are in there as well. So those kind of things, we want to make sure all that is balanced, all that is working optimally. So that's what I look at. So as a chiropractor, I just, a lot of times I find where the pelvis is rotated. I've had people who've had tailbone injuries, or when they have delivered their babies, there's a lot of pressure that comes on the tailbone with vaginal delivery, and so some things can get distorted in there. And so I want to make sure that these bones are where they're supposed to be. There's tension off the nervous system, and then I allow, everything to work better. So when everything's in the right place, things work better, things work optimally, and that is my goal. And then if a lot of times nowadays we have a lot of women, there's a lot of chronic stress. We have more people sitting at desk jobs nowadays, more people sitting and commuting in cars. I always talk about postural things like that. I think Kristi will go into a lot of that kind of stuff. Paying attention to your posture. And my second thing I'm passionate about is nutrition. So the things that support our ligaments and joints are, making sure we get proper food in us. So we want to make sure we get healthy proteins in. I'm a big fan about doing bone broths that have some of those good nutrients that we might not get in our diet anymore, calcium and things like that. Vegetable, making sure we're getting the deep green leafies that are good nutrients that support our ligaments. And some of the herbs that are out there is gotagola. Gotagola is one herb that's a tea. There's herbs that help actually support connective tissue. So those are kind of things in the office I'll work with. If I see somebody that's not stabilizing, I might refer them to a physical therapist, and we're still having struggles. Then I'll start to go to the nutritional, and we put the building blocks back into the body. So playing
I've been treating women's health physical therapy since 2008. And when I say that I'm a women's health physical therapist, people usually are confused on what that all involves. But I also treat men's health. So today's focus is on women's health, but I'll get a lot of men also that are like post prostate cancer or post-trauma. So the structures are a little different, but they have a pelvic floor, and a lot of it applies to them too. So if you have a man in your life that you know has problems also, these exercises that I'm going to teach you also apply to them. So you'll get a handout with some exercises, and you can have them do the same exercises. So a physical therapist has a doctorate degree. So I got my doctorate in '07, worked in the hospital for a little bit, and then I decided to start working in physical therapy, in women's health. So I'm an orthopedic clinical specialist, and I also am a certified manual therapist, meaning I focus a lot and do a lot with my hands, but I also do exercises. I've been taking classes through Herman and Wallace and some other places. And then just in August, I just flipped my life around and decided to work for the Round Lake School District. So I work full-time for a school district, and I do like women's health stuff on the side. So, life changes sometimes. So kind of people don't know what women's health physical therapy is, and it's kind of all encompassing. So the muscles in the pelvic floor. So physical therapists in general, and if you've never seen a physical therapist, we're the muscular skeletal specialists. So we treat the muscles of the body. And the pelvic floor it has 3 layers of muscles. And most women's health physical therapists are specialized, and we can do internal work. So meaning that we can do intervaginal and interrectal work. So soft tissue work like a massage, intervaginally and interrectally if needed. Now it's not that I do it for every patient, not that I do it every session, but that's one of the things that we can do. It doesn't always involve the pelvic floor. So it's kind of really we can take someone that, some of the stories that I have to tell are so great. And so it really helps saves people. It saves marriages, because some of the people that I've worked with haven't been able to have sex in years because they're in so much pain because their pelvic floor is so tight, because they'll have a trigger point, or they're not able to relax their pelvic floor. And these are all things that I can teach them. And sometimes they don't want me to do the soft tissue work. So I'll teach them through different tools, like a vaginal dilator, or I'll teach them just relaxation techniques and different stretches that can help relax the pelvic floor. So, and it's not always that tight muscles mean that they're strong muscles either. So I can do an evaluation on someone, and they'll have really tight pelvic floor, but a really weak pelvic floor too. So that's something that I will assess, the strength and tension in that pelvic floor. And this will sometimes look like an orthopedic problem. It'll sometimes look like a urological problem. So like they'll have trouble urinating, or people will come to me saying that, or they'll usually go to the urologist saying that they're having burning when they're peeing. But when their primary care doctor does a test, no bacteria is coming up in their urine. So the doctor just gives them an antibiotic, and then they come back when the antibiotic's done, and they're like, I'm still having burning when I'm peeing, and I'm still having constant urge. And the doctor gives them another bionic, and then they come back. So finally the doctor sends them to the urologist, and they say, well, it's because your pelvic floor is tight. Because there's a muscle that surrounds the urethra. If that muscle has a trigger point in it, then it's going to put pressure around the urethra, and you're going to get burning when you pee and a constant urge to urinate. So you need to learn how to stretch. You need to get that trigger point released, just like when you get a trigger point in your neck and you come to Betty or one of the other therapists here to get that trigger point to relax. Oh, and I do not treat pediatric pelvic floor. Although now I'm treating pediatrics, I haven't taken any classes to treat the pediatric pelvic floor. So I'll treat 16 and up. In order to treat an 18, I only do internal work with someone that is 18 and up. That is when the American Obstetrics Society has determined it's appropriate to do an internal exam on a female. So, and I would usually recommend the mom in the room or the dad in the room or the guardian for a child. So, what is the pelvic floor? So the pelvic floor is the bony structures, the muscles, and everything kind of inside of it. Like I said, the pelvic floor has 3 layers of muscles. So if I'm doing an internal exam, I'll use one finger. I don't use a speculum. The first layer is 1 finger deep. The second finger layer is 2 fingers deep, or 2 knuckles deep. And the third layer is like full. And there's muscles all the way around. So you can kind of feel all sorts of different muscles. And it's interesting because like the obturator internist is a muscle that will refer into the hamstring. So people might feel like they have a hamstring pull, and they're going to an orthopedic physical therapist and an orthopedic physical therapist for a hamstring pull, and this hamstring's not getting better, and you can't really find many trigger points in the hamstring, and then a year or 2 later they get maybe some pelvic pain also, and that's when I'll see them, and then I do an internal exam and I'm like, look at this. And really you can palpate the obturator internist externally. Like I don't need to do an internal exam to feel it. It's just still really invasive because I gotta get my finger like really up in your butt cheeks. So, but you can have your clothes completely on and I can feel that muscle. So, yeah, I've showed Betty. So one of the ways that we treat, so not, like I said, not every time that I treat the pelvic floor do I do an internal exam. A majority of the time that I'm working on the pelvic floor and I'm treating my patients, you're fully clothed. And I'm teaching you how to function because what I want you to do is go out and function and live your life. And I want you to know how your body works. So we talk about the core, and the core means, like, a good way to think about it is this box. So, and the box is like your whole core. So we have the diaphragm on top, and the diaphragm's probably one of the most important parts that a lot of people forget about. So I think 2 of the exercises I'm going to give you are about the diaphragm. And the diaphragm is the important breathing muscle. It's a dome shaped right here. And then we have the transverse abdominis, which are right in front here.
Maybe the 6-pack.
Yeah, the 6-pack.
Yeah.
Yep. Mine are just hidden. The 6-pack right there.
Yeah.
It's the deepest layer of the abdominal muscles, and its function is in conjunction with the pelvic floor to help stabilize the lumbar spine. And then we have like the multifidi, which is the little muscles in the back, and they provide just local stability for the back. And then we have the pelvic floor. So you can see there's a lot of muscles helping to hold up that bladder and everything. The problem also is it's really thin, and as we age it gets thinner, and when you dissect a cadaver, it's not pretty and pink like this. It's actually kind of like the color of Chris's shirt. It's grayish, whereas muscles are pink. So there's not a ton of contractile tissue, it's more connective tissue. So some of the things that we do to get the pelvic floor to work better is make sure that the hips and the core can contract and stabilize everything better. Because if we only did Kegels, which is something I'm going to talk to you about, then it wouldn't all work. So there's a lot of research that shows that only Kegels won't help. And a lot of people that do Kegels alone don't know how to do them properly. So I'm going to teach you how to properly do a Kegel, and I'm going to teach you some myths that were taught before that might be making it even worse for you. So the functions of the pelvic floor are for support. You need to support pretty much everything. It's like the base of your pyramid. So we got everything above it. So obviously the bladder, the rectum. If you have your ovaries and everything, a lot of people come to me after a hysterectomy. So but that adds more scar tissue and everything to the mix. If you don't have your uterus and everything, the hard thing is, I don't know if I have a picture of it, but then your bladder tips forward, and then that can cause a prolapse of your bladder more easily and increased urine leakage from that. They'll put a sling sometimes now, but even that can then cause more scar tissue and more problems with that. So it's one of those hard things. Well, we have to do a hysterectomy because you're having all problems with this, but if you're going to get the hysterectomy, then you're going to have all these other problems. So just something to think about. Toileting, obviously, you need to urinate and have a bowel movement through your pelvic floor. So if your pelvic floor is tight, you're going to have constipation is another thing that commonly happens. If your levator ani has a trigger point in it, or I'm going to teach you tips on how to poop better, because I talk to people about pooping a lot. Yeah, I have articles on like how to poop better, and I talk to people about that. And then labor and sexual function. Part of my job is to teach people like better sex positions that might help, especially if you have like interstitial cystitis, what position might be better for them, and like different techniques for that. And then labor and delivery. I work with pregnancy, while they're pregnant, and then postpartum. It's not common to be in pain or still have leakage after the 6 weeks after labor. So those first 6 weeks, you're going to have some normal leakage and discharge. Most of it's discharge. Your body's recovering from a pretty traumatic event. So that's okay. It's normal. But if you're after your 6-week appointment and you're still having a lot of pain and you're still having a lot of urine leakage when you go to pick up your baby, it's important to see a physical therapist. In socialized medicine, that's usually what they give you right away is, all right, here's your 6 weeks appointment, your 6-week follow-up, here, go see your physical therapist. So, so these are some of the common things that we treat. I've pretty much talked about most of them. Yeah. And I mentioned that I kind of see a little bit of, I'm just going through to my notes to make sure I didn't miss anything, a little bit of everyone. And a lot of people think like, I'm healthy, I'm not 80, and I've treated 80-year-olds. I've treated really, really elderly people that are not healthy enough to have a sling or something to hold everything up, so they still need physical therapy. And this one lady, she was so weak that her pelvic floor, they would put in a pessary, which is kind of this thing to hold up her pelvic floor, and it was so weak that it would just fall out. So my job was to strengthen her pelvic floor enough to get the pelvic floor to hold up her pessary. And I've treated gymnasts. I don't know if you can tell, but she was doing gymnastics and she just urinated then. Most of the younger people that I'll treat are runners, because that's more common because of the constant boom, boom, boom on their bladder and their pelvic floor. And they don't usually stop when they're running like a marathon to urinate, so they kind of like trick their brain. And urination is a reflex. So I'm sitting here, I'm talking to you all, and I don't have to urinate right now, but say my bladder was starting to expand, and it's expanding to the point where it's full of water, and my brain, or my bladder tells my brain, Kristi, you have to go to the bathroom. And so my brain says, you can't go to the bathroom while these people want to hear you talk. So my pelvic floor is like, all right, I'll just tighten up. And then it expands a little bit more, and it's like, all right, no, you have to go right now. Tell them to wait, and you go upstairs and go to the bathroom. So the pelvic floor tightens while I walk up the stairs, and then I get to the stairs, I get upstairs, and I sit on the toilet. And when I sit on the toilet, then my brain tells my pelvic floor, okay, now you can relax. So I relax, I let the urine out. So that loop is complete. So one of the myths that people commonly hear is, hey, you know you're doing the Kegel correctly if you stop the flow of urine. Well, that's going to throw off that loop and that reflex, and you're really going to confuse your brain and your pelvic floor if you do that, because your brain and your pelvic floor had just talked and communicated like, all right, well, this is what we're doing. So if I'm now in the middle of urination and I stop that flow, then my brain and my pelvic floor are going to be like, wait, I'm on the bathroom. There's not an emergency. The bathroom is not a fire. So why am I stopping the flow? So it's one of those things you can check maybe once a month or so, but it's not something that you should do regularly. And that's something that people will commonly tell me is, well, I try to do this and it doesn't work, or I've been doing this. So if it's something that you or anyone you know has tried, stop, like, now. Because you want that connection to keep working. Another thing that physical therapy works on, and that's something that is important, most of y'all haven't had kids recently, maybe you have.
What are you trying to say?
40 years now.
Yeah. Is like episiotomies and tears during pregnancy or during labor and delivery. They're scars, and so when you get a scar from a surgery or like on your arm's easy because I can show it. You get scar tissue. Just like that, people get scar tissue here. So I can do scar massage, or I can teach the husband, spouse, whatever, or I can teach the female how to do it with, it's like a little scar massager, but it, like the same kind of one you would use if you had carpal tunnel surgery. I have not, but like the same kind of one you would use on herself, because it's scar tissue. And just like that, it will build up and cause pain with intercourse or with sitting on a toilet or riding a horse, stuff like that. So, and there's different degrees of tears. So, and just like Dr. Rachel talked about, that asymmetry in the pelvic floor can cause the muscles to be imbalanced, which can cause all sorts of pain. So one of the things that people get worried about is what am I going to do during the And what does a physical therapist do? So I talked about what we can do. One of the things that people, like on that very first day, they're like, I don't know you, and you're gonna look at my vagina. So
You can buy me dinner.
yeah. So I don't usually do an internal exam on the eval. Some do. So it's possible. But we take a subjective, meaning like, how long have you had the pain? How long have you had the incontinence? How long have you had the symptoms that are bringing you to me? Same as if you had sprained your ankle and you were going to an orthopedic physical therapist. How long has this been bothering you? Well, how long has this been bothering you? And I want to know what's going on. And then I'm going to do an objective exam. I want to look at you and figure out why. And I like to look at the person. So I look at their breathing pattern, I look at their posture. I'm looking at you while you're sitting there talking to me, and then I'm gonna, yeah.
Are you right now looking
No, yeah. And I'm gonna look at you without you thinking I'm looking at you, and then I'm gonna have you stand, and I'm gonna look at you standing in front of me. And I'm gonna have you lay down, and I'm gonna put my hands on you and feel stuff. And I'm gonna look at the strength in your legs, and I'm gonna look at the flexibility, and I'm gonna watch you walk. And then I'm gonna have you do weird movements probably that you're gonna be like, what is she looking at? But it's just like, how is your body moving and how is it functioning? And some of it might make sense to you and some of it might not. And some of those movements I'm gonna go over with the exercises because they're good stretches and everything. And through all that, then I'm gonna kind of find a plan. And then if I, for some reason, have a lot of time left, which I usually don't, through the subjective and objective exam, I might do the internal, but I usually don't. When I do have a lot of time is if I already know you, like if you had already come to me for a screening, and then, cause like I worked for Athletico for 8.5 years, and they offer free injury screens. So if you'd already come to me for a free injury screen, and then you got a script from your doctor, and then I was doing the eval, well, I already know your history and I know what's bringing you to me. Then the internal exam, like I explained, and it's not all just internal. I need to see, do you have a reflex? Like there's different reflexes in the pelvic floor, so I'm looking at what's going on. How's your skin integrity? Do you have any scars? And if you do, are they mobile? You know, like I have scars that are really mobile and I have scars that don't move at all. And then through that, I kind of build an assessment. All right, this is what I think is going on. And that assessment's constantly adjusting based on how you're doing with my plan, or how you're doing with the treatment, and how everything's coming along. And then we develop a plan together. Most of the time, women's health patients are seen once, maybe twice a week. And usually, you should start to see improvements within 3 visits, as long as you're compliant with your home exercises. Meaning you should be doing them at least, some of the exercises I give twice a day, some once a day, and I want you to do them. And by 3 weeks, if you're not seeing improvement, I either miss something, so that means I have to go back and do the objective again, or I'm sending you back to the doctor because I don't really, like there might be something more involved that I don't know what's going on. So, but it can take a long time to get a women's health problem, because people don't usually come to physical therapy right when their pelvic floor hurts. Usually they're like, this has been hurting for 5.5 years when I had my first kid. And so it's not that I can get you better in 3 weeks. it might take me 6 months, but I might see you for 6 weeks, have you take a 3-month break, and then see you for 6 weeks. Because you can do these like I'll see you for 6 weeks, do manual work once a week for 6 weeks, and teach you some exercises. Do your exercises and call me, email me, and then you're gonna come back, and I'm gonna progress these exercises. But in the meantime, you're gonna keep doing them, and then you're gonna get stronger, but you don't need my help to get stronger in the meantime. So that's kind of how women's health works, is it's a long, slow process because you usually don't come to me right away. That's one of the good and bad things, is we become friends. And I have, yeah, I have become friends with people. One of my friends is, I'm not gonna use her name, so, she was a virgin, and she met the man of her dreams, and they got married, and they tried to have sex, and she was like, go ahead. He's like, no, this is really too painful for you. And she's like, well, isn't it? And he's like, no, this is not supposed to be painful. So he brought her to the doctor. They went to the doctor, and the doctor's like, this is what you call pelvic floor dysfunction. And so now they have a good relationship, and she has a kid, an infant. I don't remember how old he is. But, like, she thought that's what sex was pain. So it's kind of one of those things, like, he knew, no, I have done this before, and that is not the reaction I was looking for. So luckily he knew that wasn't right. So, and I get that with, usually the men are the very thankful ones. You get chocolate and flowers from the men in the patient's lives. So that's kind of nice. And I talked about some of the things. There's also modalities I can use. Modalities meaning like ultrasound, TENS, like the electrodes, and then like electric stim. I'll use that if the muscles are really weak and not cooperating, and there's like a sensor that you can insert in the vagina or the rectum, or there's electrode pads that you can put like around. Yeah, I've done it to myself. I think it's more comfortable to insert the sensor. Some people tell me it's more comfortable to put the electrodes around. And then I think the most comfortable would be this thing called PENS. It's called Patterned Electrical Neuromuscular Stimulation. Not all clinics have it, but it's kind of a cross pattern, and it goes through the pelvic floor. So some general tips. You want like symmetrical weight bearing. So a lot of people sit like this, or you want kind of your body in symmetry most of the time. Yeah. And like sleeping.
Everybody's sitting up straight, right?
Yeah. Sleeping and just your normal day habits, you want to make sure that you're not always slouched, and you want good posture. Because with that good posture, you'll get the better breathing. Toileting strategies. The toileting strategies that I was going to talk to you about, the pooping. So the pelvic floor is where your bowel movements come out of. What people tend to do is they strain when they poop, and they go, "Arr!" And that just tightens up the pelvic floor. So when you're straining, when you're having a bowel movement, it's going to tighten up the pelvic floor, and you're trying to get the poop out of something that's tight. So the best thing to do is to take a nice exhale when you're trying to pass a bowel movement. And let the bowel movement come out. Another good tip is something like over from China, is they squat when they have a bowel movement. So they just kind of squat like this, and that's how they have their bowel movements. They literally have holes in the floor and they poop like this. So like the term that the product, the squatty potty, is kind of based off that, but ours, they just kind of brings your feet up towards you. So it puts you in that same position by bringing your feet up. You don't have to purchase a squatty potty. You just find something in your house that will elevate your feet and put it by your toilet. And then that puts you in a good position. Now that I work at the Round Lake School District, have excellent pooping toilets in the preschool.
Yeah, really.
So because they're so tiny, because they're meant for 3 and 4-year-olds.
So we should all get tiny
Toilets. Yeah, like the ones for the preschool. So, or the squatty potties, that might be cheaper because they're like $20, $30. I think you can get a 2-pack at Costco, so you can get them for all your toilets. And diaphragmatic breathing. So we'll go over how to perform diaphragmatic breathing with the exercises. And we'll go over how to do a right and wrong way to do a Kegel with the exercises. And then another thing that people don't do, and I find this something that's crazy, is they don't use lubrication for sex. So they'll tell me, sex hurts. And then I'll say, well, you're past menopause, you need some lubrication. And they don't know how to use it, they've never used it. So sometimes if I was gonna rub my hand together like this for a few minutes, it's gonna hurt. So sometimes I just need to put lube in between my hand and have sex. So that is just, I guess maybe because I've taken all these classes and I've been talking about sex and pooping for so long, I just am fine with it. So sometimes I just have to teach people how to use lubrication to have sex. And it's okay to just do that. So that's one of the tips that I'll tell people a lot, is to use lubrication and make sure that you don't have an allergic reaction to it. So you might want to test it out on your arm because people will get allergic reactions to certain kinds of lubrication. One of the ones that I'll use in the clinic that is, I've never seen someone to have allergic reaction to it, but one girl was very sensitive to everything and wanted to bring in something of her own. It's called slippery stuff, and that's what I use at the clinic. It's very easy to remember, slippery stuff. It just makes everything glide.
And Kristi, a quick question on that. I've heard using coconut oil is okay. Have you heard that coconut oil is okay to use for that?
Yeah,
Okay.
that's what we used for the girl that was really sensitive.
Okay.
But she just brought it in herself. So these are some basic exercises that we're all gonna go through. And then I only had one extra of these. So,
I remember those.
yeah. So we'll pass it around while we're doing the exercises. And then if you wanna pass.
You might have to share.
I brought 8, so we should be good. So the first 2. Did we not have enough? Okay. Okay. So the first 2 can be combined together, and this is probably the most important exercise in my mind. Like I had bronchitis November 1st, and with all the coughing, I was starting to like pee my pants a little. So by doing this exercise twice a day, stopped peeing my pants. And it was one of those things that I was like, why wasn't I doing this exercise? Because I know how to do it. And it was almost immediately like, oh, look at that. And it's really this, so I have one of these in my bedroom and one of them at work.
Where'd you get it?
So you can buy it online. You can take a picture of the one and that's going around, and there's like a website on there. So I don't sell them or anything. I've taken classes, and after the class, she'll sell the ones that she uses during the class for like, I don't know, like, I don't remember what she sells them for, but cheaper. But if you buy it online, it's like 65, 70 bucks for, yeah, they're not cheap, but you can also make them. I've had patients make them. I'm way too lazy to make one. So the other alternative is to get a TheraBand, which is pretty cheap. You can get it at like Walmart, Target, Dick's, any of those, and a ball. So that's the easiest. The balls you can get at like the dollar store. Yep. So this is the expensive version. Cheap version, a ball, and a TheraBand. And what you're gonna do is you're going to either lay flat. I'm gonna move to the floor. Well, this is good. You're gonna lay flat and you're gonna roll your toes in and hold for 10 seconds while you're squeezing the ball and rolling your toes in. You're just gonna squeeze the ball just to activate the adductors, which are these muscles right here. You're not squeezing so tight you're gonna burst the ball. And you're doing that for 10 seconds, and then you're gonna roll your toes out and pull out against the band. Same thing, you don't wanna break the band, you don't want to go further than hip width apart. People will try to pull like this just to, I don't know, impress me on how strong they are. It's for neuromuscular re-education. So it's teaching the pelvic floor how to turn on and how to turn off. It's not for strength. So it's teaching your muscles. You can do it if you can comfortably laying flat like this, or if you're uncomfortable laying flat on your back like this, you can do it sitting in the chair. So it's either way, and they're small muscles. Like I said, they're not very large muscles. So 10 times 10 seconds is the most that I want you to do twice a day. So it's also not a more is better. So I forgot to tell my mom that, and she was like, hey, it's getting a little worse. I was like, oh, that's weird. And then she's like, yeah, so I've been doing it like 20 times. And I was like, oh, that's why. So now she's doing good. She just does it 10 seconds,
Why
10
is
times.
doing it more
Because
worse?
they're small muscles, so you're fatiguing them. And so these muscles still have to support you and hold you up
Oh, so
throughout
not
the day.
tired.
Yeah. So 10 seconds, 10 times.
How do you feel after you run a marathon?
Yeah.
By the day, you're fatigued. You're over fatigued.
So the next exercise is diaphragmatic breathing. So one of the ways is by putting a hand on your stomach and a hand on your chest. What people tend to do is breathe and only use these muscles, the apical muscles, and then what you're doing is putting a lot of stress on this neck and all of right here. What I want you to do is breathe with your belly. So sometimes people will call it belly breathing. So you're gonna breathe in through your nose, and that raises your stomach, and breathe out through pierced lips. And that lowers your stomach. Breathing in through your nose warms, filters, and moistens the air, and breathing out through pierced lips helps with that pressure balance. So,
You guys can do it in your chairs. I use this chair all the time with patients.
yeah. It's really good to help kind of calm the sympathetic nervous system also. So if you're stressed out, if you're in pain, it'll help bring that body down to relax it. And then the balanced breathing kind of goes along with it. So that's the next one. Yep. So I'm going to pretend like this is a wall, and you're going to take your right arm and reach. The reason it's your right arm is because the diaphragms, the liver's right here. The liver is on your right side, and so the diaphragm is a little bit different on the right. So it's gonna be here to help stretch out that right. And do I have the one with the ball or without the ball?
Ball. Yeah, with the
Okay,
ball.
that's what I thought. And so just so that I'm more comfortable, I'm gonna put my feet here. And you're gonna take a nice deep breath in and exhale. If that's easy, you can put a straw in your mouth. And when that's easy, you're gonna blow up a balloon. And you're gonna, it's about 4 breaths to get the balloon full, and then you take the balloon out and let it go. And make sure that you're not sitting next to the person who's letting the balloon go, because you'll get covered with spit. I've learned that. And then, and that balloon will give you kind of resistance. So, and so will the straw. I've also used like kazoos, because a kazoo is kind of the in-between of a straw and a balloon.
So that just strengthens your
Diaphragm.
exhaling
Yep.
part.
The exhaling, because exhaling is more important than the
Get rid
inhaling.
of the. So
Yeah.
what's the purpose of the ball?
To prepare you for the next exercise.
Oh.
So you're,
So-
all you're doing is while it's holding it, so
Yep.
it doesn't fall.
And it's
But
not
you're
a
doing
tight
any-
squeeze, it's
okay.
just a nice gentle.
Keeping it activated.
Yep,
And you're starting with the regular breathing, and that gets too easy, you go to the straw.
yep.
So, okay.
And then, like, if you have a kazoo, not a lot of people have kazoos though.
No, we
So-
can't say that it did.
Yeah, but you can buy them at the dollar store if you want them, because that's where I
And
bought
it
'em.
wouldn't be good to just keep doing the regular breathing, you have to progress.
I would suggest progressing.
Okay.
Which balloons, I mean, you can buy like a,
Smaller balloon, it's harder to blow.
It'll get smaller and smaller.
Like a water balloon.
I don't know. I just get a big pack of them. The next one is 90-90 hip shift lift. I really like, this one is probably my next favorite exercise. So, you're gonna put the ball here, and you're going to, your right arm overhead, and you're gonna do a little bit of a bridge. So, you're gonna round your back just a little, and you're gonna shift your right up, and then you're gonna squeeze in with your left, and march. Now your feet are on a wall and not a chair. Do you want me to demonstrate it with my feet on a wall to make it easier?
No, it's fine.
Okay.
So is your butt up right now or no?
Yeah.
Oh,
Well, my tailbone's off the wall,
right.
so,
So you're lifting,
Oh.
bridging.
so yeah, I'm doing like a
So
little
it's just-
bridge. So it's like that.
Oh,
So it's very tiny.
Tiny bridge.
So you can keep balance on the wall with the other foot,
Yeah.
just
And you're breathing. No, you're only marching your right foot.
only your right.
One in.
Only your right.
Really?
Yeah.
You're fine.
Because of that whole liver and the diaphragm.
Really?
So you never do your other side?
Never do your other
I'll
side.
be there.
So,
Wow.
Good question.
I mean, well, no, she
It's-
caught me doing
it's a lot
this.
it's a lot to
Is
explain
your
in
left hip
a little,
off? It's off the floor because you're in
a
little
sort of bridge, yeah.
So your left section is always off the ground
Yep.
as well.
So your left hamstring gets really tired.
Yeah, I bet.
Yeah. And you're also squeezing the ball with your left, so your left adductor gets really tired. So you're really working your left hamstring and adductor. And then the next one is serratus punches. So, this one I like to do the deep breathing with. You're gonna reach up and down. The serratus anterior is right here. So this is another one to help with that breathing. So you're just gonna come up and down. It helps open up your thoracic cavity. This one's pretty easy. If it is easy for you, you can hold it up there and do the breathing, or you can add weights. So that's a pretty simple exercise. The clams, I might do the clams and then get to the Kegels. Did someone groan over the clams?
Yeah.
Oh, think they're very hard. Oh, okay. So, the most important thing with clams is making sure your hip doesn't roll backwards. So you're gonna come up and down. People like to go as high as they possibly can, and that's not what I want either. So you have these two like headlights on your hips, and you want them to stay pointing forward the entire time. So imagine this is my headlight, and you're gonna come up and down, up and down. So I would know I went too high because it starts to tip. Up and down. Another way you can kind of assess if you're going too high is do it laying it against a wall. So if this is a wall, then you would know you're going too high because you can't go any higher. And I want you to do both sides. And then Kegels. So I talked about the stopping the flow of urine. I don't want you to stop the flow of urine. The Kegels are in the last, and I didn't put a picture of a vagina on there. A nice.
Thanks.
Yeah.
Thank you. Nature.
Yeah. So the thing with Kegels is when I'm doing an internal exam, so we grade muscles. If I'm gonna grade your bicep, a 5 out of 5 is perfect strength. If I'm gonna grade your pelvic floor, in order to get a 5 out of 5, I have to feel my finger get sucked in and lifted towards your belly button if you're laying flat. So if you're laying on your back looking up at the ceiling, my finger should get pulled in and sucked up towards your belly button. So a lot of people think, Kegel, tighten everything. No. I should not see or feel your abdomen tighten or your butt tighten either. So doing a Kegel, no one else should see anything tighten. It's only your pelvic floor, and it should be sucked in and up. And that's kind of what it should feel like. There are pelvic floor trainers online you can buy. There's like this kind of cute one, yeah, not like that, that you insert, and then like a little flag will pop up if you're doing it correctly. So yeah.
Wow.
So if you're laying there, yeah, and like we have biofeedback units, same thing. You insert the unit, and then I also put a sensor like on your stomach and on your butt. So the sensor will tell me if you're activating your stomach or your butt. And it's like biofeedback. You'll see the star bloom or whatever I set the computer to. And then I'll be, whether I'm working on quick flicks, meaning just tighten and relax, or 10-second holds, like hold, relax. Because another thing people have trouble with is, okay, now I taught you how to tighten your pelvic floor, now you have to learn how to relax your pelvic floor in order to have a bowel movement or urinate. Then the next two are standing. So we'll go to the lunge matrix. So this is that weird movement pattern that I said I'm up during the the objective that I might have you move in ways that you're like, what is she having me do? These two are like, I call them, or we call them, they're like from a certain classes that I've taken, triplanar movements. So I got water.
Hey, refilled you.
So your body works in all different planes. When people train their body, they generally only train in one plane. So they want biceps, and they want squats, and they don't really do much else. So this lunge matrix takes you in multiple different planes. So you'll go here, and you'll go here, and then you'll go here. So yeah, so and
I'm
you'll
not coordinated.
go here. So that's the nice thing is by moving my arms, I'm getting my core a little more activated. I'm getting my arms, and that core is the diaphragm, the pelvic floor, the abs, and the back. So I need that all to work in concert in order for me to get function. If one piece is not working, then it's not going to work. So if my diaphragm's not working, my pelvic floor might not work. If my pelvic floor is not working, I might get back pain. So they're all connected. So that's the pelvic floor matrix, and then trampoline or wall planks. So I'll demonstrate those here, I guess. But it's just up and down, getting my body to move. So there, and then here.
Moving.
I know. Should have worn yoga pants. And then here. So now to make it harder, the further your feet are away from the wall, the harder the exercise. So you can take that wall plank and turn it into a plank on the floor, and it would be harder. But doing it on the wall, you get the contracted, you get the abdominal work even with that. So people tell me, I can't do a plank. Okay, let's do it on the wall. And you'll still get the core work. So, any questions with any of those exercises? So, I believe my email address is on here. Can I put it?
I can't read it. I have to use my little
Nope,
one.
okay. So,
Kristi, when do you like start noticing the difference, like that?
so if you do that first exercise twice a day for 3 weeks, you should notice
What
an
first?
improvement.
Oh,
So
this
just
first
this,
one?
just these first two.
Oh,
The
You
ball.
combine those two, and just, if you do that first page twice a week for 3 weeks, you should notice an improvement.
in what, like?
Whatever's your
Whatever's
symptom. Yeah.
whatever's bothering you, so to speak?
So the first class I ever took was called Roll for Control. And like pretty much her whole, so you can write down that, Roll for Control was her first class, and my first class. And her research, and a lot of the research that was pretty much, you activate the adductors and the obturator internus, and that alone will show improvement
So
after 3 weeks.
So that's the inner thighs and deep in the buttocks.
Yeah.
Those are the muscles.
I mean, that's a lot.
Yeah. So
Okay.
just by doing those two, that first page of exercise, you should see improvements. But I mean, obviously, I don't know what everyone's problems are.
The adductors, which is a real, in my world, it's a real weak spot.
Yeah.
But that's very much related to the pelvic floor, no?
Right. They
So when
interdigitate
this-
into the pelvic floor, meaning that
When
they
this
connect.
collapses, everything else goes with it.
Yeah.
Right. And clinically, like in my office, I tend to find everybody, most people in our society are weak on the inner thighs,
Yeah.
tight on the outer thighs. That is this common thing. So I do give a lot of isometric exercises alone, just to do
Unless
those
you're a
reasons.
horseback rider.
Right.
Don't
Yeah.
boy.
Yeah. And how many of those are around here?
Right.
You know, we have a handful, but that's not common.
And so if you're a
We've got
horseback rider,
handful
I'll
and they
change
don't-
that.
They don't have pelvic floor issues.
Well, they do, but in different
It's
ways.
tight. It's
Oh,
tight.
boy.
They have like this weird tightness.
Yeah.
So.
Why don't you go ahead and just say out loud your email?
So my email is Kristi, Z as in zebra, ANN@hotmail.com. So my side job is at Athletico, that's where I work, and we ordered cards and they never came in. Well, they haven't come in yet. So we checked today and
Which
they're still.
Athletico?
Any, I can work at, because I work full-time at the school district, I'm afloat in McHenry and Lake County. So whatever clinic is closest to you, obviously, I live in McHenry, I work in Round Lake, I would like to stay like
Somebody in between.
somewhere in between. But whatever clinic's closest to you, I can come treat you when I'm done with work.
What do you what do you do at the school district?
I'm a physical therapist.
She works with kids.
Yeah.
Wow, like after school?
No, during school.
Really?
Seven.
It's a full-time.
Yeah,
She's
7:30
got
to 3, Monday through Friday.
So she does.
Do all schools have that?
They try to.